All right, so for this, for your question or the concept of how I feel about diabetes, personally, I think we've made great progress in the last 20 years as far as the available medicines that will help control the diabetes outbreak. And as you know, you can see on the Center for Disease Control website the marching of the obesity rate over the last 20 years in the United States. With obesity comes diabetes, high blood pressure, high cholesterol, and then death. So early death, I should say, because everybody dies, right? The problem with, I think, diabetes is that when I see people with diabetes that either come to me in the immediate care center for a sickness, and then I happen to ask them about their diabetes medicines and how it's under control or not, or if I see them in the integrative medicine clinic and they want advice on how to potentially lower the use of the insulin or the oral medicines, it seems that the patients I see don't have any ideas about how weight is involved with the diabetes. Now, granted, they do have some information of that if you're obese, you're going to have more problems. Yeah, everybody knows that. But I think there's details with the food industry that are really available on the internet that you can learn about glycemic index, high fiber, the amount of fiber per day. It used to be in the 90s that whenever we had a diabetic, I would actually suggest taking Metamucil because it increased the fiber. That was 20 years ago, more. It increased the fiber of the meal, which we didn't know back then, but that would decrease the glycemic index or glycemic load. When you have a lower glycemic load, the food releases its sugar slower into the bloodstream instead of a massive hit of high sugar at once, which is nice if you're hitting the wall at 14 miles in a marathon, but if you're just sitting there eating a meal and you have a sudden massive shift of sugar into the bloodstream, that can cause a problem. In a diabetic, it can cause diabetic coma, it can cause DKA, diabetic ketoacidosis. The pancreas, if it still works, can kind of adjust for that. It can send out a massive amount of insulin so that the insulin will match the floating glucose and it'll put it into the cell and lower the serum levels of glucose, because that's not healthy to be too high either. The problem I see is that what most of my diabetics come in with is for a high sugar level, they'll just increase the dose of the insulin. And if you increase insulin, no question, you're going to tuck it away into the cell once it binds with sugar. But if you have a brittle diabetic, it's important. If you have an average diabetic or a beginner diabetic, an early onset diabetes patient, and they're just used to hitting the pump and or giving themselves a shot, even if they take their sugar through finger stick on a regular basis, if they find elevated sugars, they just give themselves shots to lower it, versus using diet to decrease the chances of even getting to a high sugar level. So I think that we're doing great with treating the effects, but we're still in the dark ages as far as treating the cause. Now, if I know you're going to ask what happens when you're genetically at risk for diabetes, and if you're going to have it because everybody in the family has a diabetes issue or type 1 diabetes, then I think you can still postpone it. I think you should still be able to maximize on nutrition. I think you should still be able to maximize on exercise. And sometimes there are supplements to help with that. You should always maximize on weight. I think that, I should say weight control. If your average American is, or I should say if 33% of the Americans are already morbidly obese or overweight, then we know nobody's really maximizing on control. And this is with all the fancy medicines of the world being concentrated in the United States. So the suggestion is always that we take care of the diabetes if it flares up with the medicines that we give either in the emergency room or in the office. If you can please try to get exercise involved. I had a patient yesterday who came in and she just started to get into exercise, both her and her mom. Exercise offers a back door, an escape for sugar, if it's high in the bloodstream, to get into the cell without insulin. So whether or not you have a cell that has receptors for insulin, or or even the pancreas that makes insulin anymore. When you exercise, doesn't even matter. When you exercise, there's a built-in mechanism that sugar goes right into the cell to be digested by the cell for energy. And that's why after exercise, usually sugar lowers because the muscles take advantage of the cell, of the sugar. My young student yesterday said that she was frustrated because in her exercise to lose weight and get healthy again, she has an increase in sugar first and then it lowers. Well, that's because of the stress response. Anybody that's starting to get into an exercise routine will usually induce a little bit of a stress response, kind of just to get the heart rate going and get the breath going and get the pulse rate up or the metabolic rate up. And that can induce a little bit of a rise in all those parameters, all those vitals I just mentioned, in addition to sugar, because the body's going to prepare for fight or flight. If you can control that and keep it to a low level and then yet get the exercise in, then you'll benefit from, again, the backdoor entry of sugar into the cell without the presence or need of insulin. So that's a given with any diabetic. And I don't see that many diabetics exercising, unfortunately. Now, you don't have to be a marathoner. You can just be doing yoga. There's a new study that was just released out of the Journal of Complementary Alternative Medicine showing that breath meditation before and after eating would lower the glycemic index after a meal. And that's easy. That's something that's very easy to do. You can actually, it's a relaxation technique. And you can see my other videos on breath, meditation, relaxation techniques, mindfulness by Dr. Deepak Chopra. All these things help to bring down the stress response. If you can do that before exercise, during exercise, or incorporate some kind of yoga movement or breath exercise, then the exercise will be threefold increase in improvement. So that's why, again, the bottom line is when you're diabetic, I think it's very important to know and treat the cause. And yes, you can't change the genetics, but I do believe with the work of Herb Benson, you can change around when the gene is exposed. Just think of it this way: if you have the genetics for diabetes, and you're obese, you're smoking, you're injecting IV drugs that you shouldn't be doing, well, you're going to get that genetic exposure faster than if you lead a healthy life and eat pure organic food. I'm not suggesting everybody eat organic food, but I'm just using that as an example. If you try to lead a healthy life, then the exposure will be pushed back a couple decades. It would be great if it was pushed back until you were 60 or 70, then you have a great bill of health. My young person who came in yesterday said that she was okay with the insulin that she was doing. She was sticking her fingers as usual. This was the first time she ever had a dehydration state. She wasn't sick, just got a little dehydrated from the festivities. And her sugars went into the 2s, actually into the 500s, but came down nicely as we hydrated her. So in her case, she had stated that she doesn't want to let diabetes rule her life. And I accept that, but I think that it sounds like if you follow the lifestyle and control of diabetes and the control of the expression of diabetes, that you have to be a prisoner to this strict lifestyle. I don't think that's true. I think that the opposite is true. I think if you lead a healthy life, manifest well-controlled diabetes and sugars, maybe even get off so much insulin, maintain with diet alone, which is sometimes possible, I think you'll actually be very happy with that lifestyle versus kind of living what you want, living the way you want within the realm of diabetes, using the insulin as necessary, but being a young person as usual. I think there's ways to enjoy life no matter what age, no matter what profession, no matter if you're a student or an athlete. Enjoy the way you're experiencing it, and also manifest health. So the expression of health is different with everybody, just like diabetes. My mom and daughter patients that came in yesterday, they said they go to different doctors, and an eye doctor said take omega-3 fish oil and vitamin D, and another doctor said no, it doesn't work, and another doctor said yeah, you should be healthy and exercise. The bottom line is that with the role of what Andy Weil and the other doctors that practice integrative medicine are doing, and the research that's coming out, we're finding that this is all worth it nowadays. They're having randomized control trials that back up the information that say all this healthy living is worth it. Now, when you go to doctors that don't know about nutrition or haven't studied nutrition, don't know about integrative medicine, they'll tell you, yeah, you should exercise, but they won't give you guidelines. And I think it's very important to know the guidelines, know who to listen to, and then also know where to get the information from to empower yourself to lead the best life you can. And that's why I'm doing what I'm doing with my videos, but it's also important to give tight guidelines and make sure you don't fall off the wagon. And when you have somebody that's diabetic and on insulin, I got to make sure that the disease process is under control first with the medicines. Once that's under control and I make sure that nobody's going to have any life or death issues, then we can start embracing alternative medicine. Once everything's controlled with the disease process and Western medicine, then we embrace alternative and complementary and try to get to the best level of health that you can lead.